Our next speaker is Ashwini Prasanna Kumar. She is the coordinator at Bangalore Birth Network. A nurse by profession, she will speak to us on the voices of women during the pandemic. Over to you, Ashwini.
Hi everyone, I am Aswani Presanna Kumar, a freelance counselor by profession with a nursing background and working with Bangalore Birth Network as a program coordinator. It's my immense pleasure to be a part of this conference and happy to share about women's voice during pandemic. The COVID-19 pandemic and strict lockdown in India, not only India, actually worldwide, have affected reproductive services adversely. The curbs in the movement and enhanced fear of infections among patients and healthcare providers resulted in dramatically reduced availability of services. The pandemic was a calamity unfolded everywhere. For an organization like us, left wondering to find a way to reach women because persons pregnant, soon to give birth, postpartum, or with an infant need guidance and care. These needs have intensified during the pandemic. So, we launched a pan-India COVID-19 mother-child helpline in early April. We have 18 quality volunteers certified in maternal and child healthcare, such as childbirth educators, lactation counselors, psychological counselors, etc. And our counselors speaks 8 local different languages, that is Kannada, Tamil, Malayalam, Telugu, Hindi, Marathi, Punjabi and Bengali, spoken by majority of Indians. They were trained with the specific guidelines made from resources such as WHO, ICMR, IAP, etc. by senior health professionals. Callers from Kerala and Tamil Nadu in the south to Kashmir in the north and from Pakistan, Kuwait, and Dubai have accessed the services. Across between the helpline and the direct messaging, we had over 1,000 women contact us. Among those, 50% of the calls from Karnataka and the remaining were from all over the country. Calls have crossed routine to life-threatening issues. There were a variety of issues and reasons. The main themes or recurring similarities include looking for providers. It's not just recommendations, it's because women had zero access to care. Second was about vaccination. Mostly in perspective of virus scaring the infants made more even vulnerable because they are not vaccinated, and also concerns about additional risks that may create. Third one was about the fear and worries contacting during birth. The fear was about going to hospitals that they may get infected and being alone as there were restrictions for the bystanders. We had questions on not having access to antenatal care. Most of the women lost their routine care. It was scary for women, especially vulnerable with medical conditions. One pregnant woman with thalassemia called from Ahmedabad, unable to find a doctor. Several she contacted declined to take her as a patient. We get calls regarding COVID testing. COVID testing for pregnant women before getting admitted created a lot of stress and women had to visit multiple hospitals. The remaining calls with variety of situations including maternal death. One NGO staffer called us from rural Rajasthan because a woman 36 weeks pregnant with symptoms of eclampsia was not admitted to the PHC because the staff feared she had COVID. She died while being taken to another hospital by her family. This was early in the lockdown. The caller relayed this case and asked how this could be prevented. Beyond the loss of life, the psychological and financial cost for women, family, and societies are severe and long-lasting. For many of these mothers, it simply didn't have to be this way. In summary, during COVID-19 pandemic, women, and babies are susceptible and at risk due to gaps in care that can result in adverse birth outcomes, including mortality. The decrease in the number of institutional births means that many women give birth at home, but due to poor community health monitoring, we do not know what happened to millions of women. Although the country has opened up partially, there are still multiple limitations to preventive and emergency care for everyone. The poor are the most severely affected by this. Thank you.